gonna be going right through this joint line, right through here, okay? Wow. Very cool. Yeah. There's the joint line. Perfect.
Whoa.
All right, so I've got Haiti right here. Haiti has been dealing with some pain in her low back, in her knee for just about 6 years now, and she's tried some PT. She's been getting massages, but she's still dealing with some stuff. But Haiti, fill us in. What have you been feeling, and why is it bringing you here today?
I've been feeling lots of like pinching, like in my back, my lower back, my knee sometimes locks in place, and I keep getting told that nothing is wrong, that everything's fine, that 2 sessions and you'll be fine. And then I keep coming back and back, and my cousin and my mom have came here and they told me like how much better they feel, so I was like, okay, I need to try it. So that's why I'm here today.
100%. Well, over the last 6 years, how have these 2 issues been affecting your life?
I just feel like I can't fully be active, so I've stopped going to the gym. I stopped doing at-home exercises for like some time, and then I slowly go back in because I feel a lot better, or supposedly I feel a lot better, and then it just comes back, and then I have to stop, and then I feel so like unproductive. Like I want to be able to move and do things.
100%. You're what, 21 years?
I'm almost 21.
Almost 21 years old?
Yeah.
So you should be able to move and be productive. This is like, you should have the most energy in your life, right?
Yeah, for sure.
Yeah, so we have to figure out what's causing this, right? In my world, it's like if there's some sort of feeling of dysfunction, there's probably something going on. We're not going to dismiss it by saying it's normal, right? We have to get to the root cause of it and try to fix that, okay? On top of that, you don't have any symptoms in your neck, but your neck is showing some signs of whiplash, right?
Yeah, that's crazy.
Yeah, lots of header drills, a lot of soccer. How many years have you played soccer for?
I would just say, honestly, just 2 years. Like when I was little, and then my freshman year, and that was it.
Okay, gotcha.
So not too much.
Enough to kind of throw things off. I mean, while you were playing, any big falls, injuries, head injuries, anything like that you can think of, or you think it was just playing the game?
I think I would fall most of the time because I was just mainly clumsy.
Yeah.
But maybe it was that. I'm not sure.
Yeah. Most of the time. Okay, so that probably points to why your neck's looking the way it is.
Yeah.
And if I could help you get rid of the low back pain, the knee pain, help your neck move a lot more freely, what would be different for you?
Honestly, just being able to like just stand normally and not have to like bend forward for like 2 minutes, and then because that's the only thing that has been relieving it, or like just being able to sleep peacefully without having to like find that little spot that like feels amazing.
How long does it take for you to like find a comfortable position?
It can take me up to like an hour. I'm being really honest, because I find the spot and then I move slightly and then it's gone. So I have to like find it all over again. Yeah, it's so bad. Yeah,
that's not fun at all.
No.
And then for you said around 6 hours you start to feel pain in the low back. You kind of have to fold forward too, just to get some relief too.
Yeah.
Okay, we really got to figure this out. Okay.
Yes.
Okay. Well, why don't we do this? Let's have you stand over there, and we're gonna face this direction, and then go ahead and let's have you bend forward, reach for the toes. Good, so we can hit toes, pretty good right there. Maybe put your hands on your chest like this, keep them glued right here. Turn your whole upper body one way as far as you can go. Okay, any discomfort there?
Right there, yeah.
Yeah, I can see your face kind of changing a little bit.
Yeah.
Let's see the other side, nice and easy. Also a little, looks like, a little wince on that side too. So discomfort turning both directions.
Yes.
Okay, try looking to your left as far as you can comfortably go. Your neck's fighting you a little bit too, huh?
Yeah.
Let's look to the right side. A little bit tighter on that right side. So, this isn't something you've thought about, huh?
No.
Okay, so it's just been kind of there lurking in the shadows, taking the back seat to the low back of the knee, huh? But your neck looks like it's got some tension going on for sure.
Oh.
Yeah, that's not feeling great either, huh? Okay.
No.
Why don't I start there then, okay? So these are your first ribs. So whenever there's like, a loss of curvature, reversal of curvature, these guys get tugged on a lot, Okay. They're very, very important to have a line for neck function and shoulder function. Okay. So we're gonna work on that next. This might be a little tender right here, okay? Little clicker thing. So we are adjusting here. We're just using a tool to do gentle taps as opposed to doing like these big pushes or big drops. Okay, so we got the left side, let's get the right side. Okay, go back to the left, okay? Hang in there. Okay, just with that, try looking both directions now, okay? Look to the left. Oh, yeah. Look to the right.
Oh, so much better.
Wow.
It's like, whoa.
That's just one thing too. So I'm gonna stand behind you. I'm gonna check out your neck, okay? Right behind you here. And let's just do a little scan. Let's kind of like feel around and see what the motion's like. So it lowers is not too bad, but then it starts to kind of slow down. Yeah, you feel that there?
Yep.
So that's where that for you, like that curve kind of transitions, right? It's going the right direction and then it angles forward, right? So that's like that classical whiplash neck. That one's got to go. Right here too, okay? So let's see. It's a little bit less tension here, so I'm going to start on this side, okay? I'm going to lean over this direction. And we're going to be going right through this joint line, right through here, okay? Wow. Very cool. Yeah.
I was expecting it, but like, it's, wow. Okay. I'm like sweaty.
Yeah, there we go. What'd you feel there?
Like my head is floating, but like in a good way. Like I don't feel like it doesn't hurt. Like it feels so nice.
Yeah, you didn't realize how heavy your head was before, huh?
No.
Yeah, that was half of it. Let's get the other half too, okay? Right behind you again. Right through here, okay? So we gotta lean a little bit more here. So keep going to the left. A little bit more rotation. Right there, there's the joint line. Perfect.
Whoa. Wait, that one felt so much different.
Yeah, bigger bone, bigger bone.
Yeah, I felt like all of it cracked one by one. That's what it felt like.
That was a good one.
That was really good.
Try looking left and right again. Look to the left.
I can like go further.
Yeah, that's 100% by the way. So you're, I mean, A+. Good job.
Thank you.
How are you feeling?
So like it. No words. It just feels so good.
What did I take? 2 minutes? All right. Here, keep your knee completely straight. Lift your whole left leg as high as you can go. Okay, and relax. See where you've got a little back pain? Your muscles aren't working. Okay.
Yeah.
Let's see the right side. Wow. Okay, 20 years old, huh?
Yeah.
Okay. Gosh, we gotta work on that, okay? Okay, your left leg is short. It stays short when I bend, so that means your right sacrum is dysfunctioning, okay? So this is pulling back on the right side and your tailbone is swinging to the left and tucking under, okay?
Okay.
So we're gonna have to clean that up. Your hips aren't too bad, it's mostly just the sacrum right here. So I'm gonna push in and see how that balances things out, if that evens out your legs, and it does, okay? So now I know I need to adjust your right sacrum with a little bit of rotation. So we're gonna lift like this, and we're dropping like this. Okay? We're gonna line the hips back to a normal position. Get your legs even too. Okay, do me a favor, take a breath in, hold your breath. Exhale. One more time, breathe in, hold. Exhale. Good job. So it's getting better through here, and then see how that motion kind of slows down here and you get really stiff?
Yeah.
So your mid-thoracic is messing with your posture quite a bit, and that could be adding to the next situation. Okay, we're gonna improve your posture a lot right now, okay? So this area right here, there's like a block of bones that are just stuck. We have to basically use this block to extend back, create more motion so you can lift up your posture properly, okay? So it should feel a lot easier to hold the upright posture after this, okay? Right through here. Can I borrow your right hand for a second? Bring this across. Hold there, let's see the other one. And then bring this under. Hold right here, relax the elbows down, okay? Okay, we're gonna roll back together, all the way back until your head relaxes onto the table. Good, right there. We're starting to move. Okay, I got you here. Tuck your chin a little bit.
Oh.
There we go.
Ow.
Yeah. Perfect. Let me help you. Nice and easy. Take a moment.
I don't know if you can do that.
Yeah. You're like, what's back there?
I felt nice though.
Right?
Ooh.
Yeah. What are you noticing?
Like I don't have to like force it.
Yeah.
You know, like it just naturally just not sitting there, but like just sitting there.
That's how it should be. You shouldn't have to think about, sitting, right? That's important. Okay, that's good right there. We're gonna, Vidi. Your posture,
I know, it's hard.
we just got your neck. We got to keep it clear.
Right when I went like this, it cracked.
Yeah, I know. You want to make sure it stays there.
Get a dog phone. Why?
Cut her in the act.
Yeah.
So we're gonna go like this. I'm gonna bring this over with the top. Actually, let's bring the shoulder down so it doesn't bump into the headpiece. I'm gonna roll you, okay? All I have you do is hold this elbow,
Okay.
and we're gonna adjust your sacrum right here. So we're bringing it down and in, right through here.
Oh.
Wow, perfect. Uh-huh.
I thought I was gonna fall off the table, but that felt nice.
Yeah, those are the best adjustments. I haven't dropped anybody in a couple days, so I'm pretty good. I'm just kidding.
I'm lucky.
Let's bring this up right here. Let's go like this. And you're gonna hold the elbow again right over here, okay? I'm gonna roll you a bit. So now we're gonna get your L4, okay? So it seems like the same adjustment, but we're going a little higher, smaller bone. So we're gonna push it right through here. Perfect. Wow.
Wow.
Beautiful.
Yeah, beautiful.
Yeah. You can breathe, by the way.
You can tell.
What we're doing here, we're trying to open up the disc spaces in the spine. Your neck's got a lot of like tension and compression from that S-shaped curve, and we got a lot of tension on the low back, right? It's so uncomfortable that it's causing you pain with standing. So we have to open both of those up, okay? So you're gonna feel a stretch through the spine on this one, all right? So all I need you to do, put your hands on the belly button, teeth in contact, so you don't have to clench, just keep them touching, and just breathe through your nose, okay? And now we're gonna start lengthening your spine a bit. So keep breathing. Yeah, you're doing great. Keep breathing, deep breath through the nose. Good job. Beautiful. Good.
Good thing you said deep breaths.
Yeah. What did you feel there?
I felt like my whole spine like stretch.
Yeah.
You know, and it felt great.
Yeah. Especially after 6 years of pain, right?
Yeah.
Good. So I'm gonna check things out first, okay? So, Vidi, you wanna see? Look at how rotated this bone is compared to this one.
Rotated.
So look at these, my fingers are supposed to line up. And she's very like not lined up. Oh no.
That one's all the way that way? It's like this.
Yeah. Just for good measure, I'm gonna check your other knee too, because oftentimes that same pattern is on both sides, especially in athletes that have worn cleats in the past, right? Cleats are very narrow, right?
Yeah.
Creates almost like a really unstable base for the knee and the hip, which a lot of times the knees get issues. I mean, you hear all the time, soccer players get MCL, ACL, meniscus injuries for that reason, right? So we're gonna look into the right side too. I mean, same thing.
No.
If anything, it might be a little more on your right side. Okay, we're gonna clean that up. Can you lift up this leg for a second? You're gonna relax right there. This is like a mini version of what we did for your pelvis, where the table lifts and drops. Okay. Doesn't feel like anything, huh?
No.
How does that look, Vidi?
Yep, much better.
A little more, okay? Almost there. Okay, there we are. Lift up the leg. Go ahead, relax there. Yeah, the body, it needs a very specific and detailed approach. But sometimes the treatment, once you do the analysis, the treatment itself is not that crazy. So I'm gonna be adjusting your ankle to help out with your knee, so you have a better foundation too. Okay. Loosey goosey.
Whoa.
Yeah. There it is. One more. Loose here. Good.
Oh, dude. I didn't know you can crack that.
Yeah, you needed it, right? Especially after, all the issues you've been dealing with. Okay. Okay. Now keep your knee straight. Lift your left leg high as you can comfortably go. Okay. It's waking up. It's better. Let's see the right side. Good. Okay. A lot better than before. Watch this. That's the first rep. Let's see how it does when we do it another time. Lift the left leg as high as you can go. See how it's getting higher?
Yeah.
Let's see the other side, right side. Getting higher. Another rep on the left. High as you can go left side. Good. Now let's go right side. Good. I'm happy with that. We've tripled the height of your leg basically, okay? I still want to see if we can get a little more. Okay. So hang in there, okay?
Okay.
Hold on to that armrest for me. Just gonna loosen up some scar tissue in your low back. Good.
Damn.
Yeah. Damn indeed. Good. One more inch. It's gonna be 6 foot by the time we're done. All right, keep your knees straight. Lift your left leg as high as you can go. There we go. We got a few extra inches on the left side. Let's see the right side now. Same thing on the right side. Excellent. Yeah, I'm glad I did that. So we got what we wanted. Okay. So on your end, how does that feel compared to the first time?
It doesn't hurt when I lift it.
Sweet.
Yeah.
6 years later, we got something, huh?
Yeah.
No more pain. Beautiful. I like that. All right. Let's try this again. Go ahead and bend forward, reach for the toes or the floor. Good. Easy peasy. How does that feel compared to the first time?
Good. It feels like looser.
Looser.
Like I'm not like tight or anything.
Excellent. Excellent. Good. Have a seat over here. Put your hands to the center right here. Remember, they stay glued here. Turn as far as you can one way. Oh, wow. Good. With a smile on your face this time. Let's see the other side. Good. Any pain with those? No pain. No wincing. Looks like you're happy to do it as opposed to struggling.
Yeah.
Lift up the posture for me. Look to your left as far as you can comfortably go. Perfect. Right side. Also perfect. Good job. Good. How are you feeling right now compared to when you first got here?
I can't really feel the soreness, but like I feel good. Like I feel very much not flexible, but I feel like I can move without carefulness, like cautiousness.
Yeah.
Because I feel like I would move with caution, and right now, obviously, don't like just go right ahead and like move however you want. But like I can feel like I can, like there's no pain, like nothing.
Good.
Nothing feels stuck.
Yes, that's how it's supposed to feel when you're 20 years old. Welcome back to your 20s.
Thanks.
Let's try walking around a little bit. Let me know how the knee feels. Let's see how it feels. Take a little lap around the table.
I can feel a difference on my left one for sure. Like it doesn't feel like the term like stuck.
It doesn't feel stuck.
It doesn't feel stuck.
Good.
Yeah.
That's great.
20%.
Yeah. So yeah, go ahead and have a seat again. Yeah. So your left one was the symptomatic one. Right one didn't really have any symptoms, but they had the same pattern.
Yeah.
There's a saying, an ounce of prevention is worth a pound of cure, right? So even if it wasn't feeling symptoms, if something's off there, we want to fix it so it doesn't turn into the same problems that the left one has, okay? Because it's possible, okay?
Yeah.
Both are balanced. Everything looks great. You pretty much hit 100% range of motion and everything. So good job.
Thank you.
You did great. No problem.
Thank you.
Yeah.